Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the public health update with data accurate through July 21st, 2022. Today, I want to address an important question, which is what should I know about the global heat wave? This is a little bit of an update of the video that we did a month ago. That one focused more on the individual impacts of heat. So if you're interested in that, I'll put a link in the email to take you to that video. But really today, I want to talk about this unprecedented heat wave that's been in the United States and in Europe, with thousands of people dying, records, all-time records of temperatures being set, and so on. And of course, while we think of it being largely in the United States and in Europe, of course, it's something that's happening everywhere in the world. And if you look at some of these temperatures, they're really quite phenomenal. The one in Iran listed there, 46.5 centigrade, is a little bit over 115 in Fahrenheit. And you can imagine that that has tremendous impacts on health, agriculture, and a lot of other issues. Unfortunately, what we know is that the average global temperature has been rising for close to 100 years now. And as worrisome as that is, projections suggest that rather than 1 degree increase that we've seen in the last 100 years, we may see another degree in the next 50 years. The United Nations has called climate change the biggest health threat facing humanity. I'm not sure that that's true, simply because I think the most recent pandemics have suggested to us that we lack the capacity to respond to a serious infectious disease outbreak. But let's accept that it's certainly one of the biggest health threats facing humanity. And the UN suggests that between 2030 and 2050, that there'll be 250,000 additional deaths every year from the impact of climate change. And the economic cost is estimated to be between $2 and $4 billion a year by the end of this decade. Now, as we mentioned, there are a lot of heat-related diseases that we talked about a month ago, but there are a number of other factors associated with heat that impact human health and well-being: the melting of glaciers and ice packs and rising sea level, increased drought, wildfires, impacts on agriculture, animal and insect habitat, human habitat, and of course, energy demand as well. Now, because we covered the heat-related issues a month ago, I'm not going to address them today, but I do want to talk about some of these other factors because they're very significant. And the first being rising sea levels. Now, increased temperature raises sea levels for two reasons. One, it melts ice and glaciers, but also water expands when it gets hot. And over the last 120 years or so, we saw an average increase of 0.06 inches per year. Now, in the last 30 years, it's doubled to 0.12 to 0.16. And you can see this continuous trend of rising sea levels. And what you can see is that we've now raised about 10 inches of sea level rise in the past 120 years. It's projected that it will raise an additional foot in the next 30 years, which is as much as we've seen in the past 100 years. And this is a particular problem because about 1 billion people live less than 10 meters above sea level. And of course, sea level rise is a problem in and of itself, but also during storms, there's a storm surge. So if the sea has risen a foot and the storm surges 6 to 10 feet, you can see the impact of that. Now, sometimes we tend to think of rising sea levels as being a problem for homeowners, who lose their vacation home. But if you think about it, there are 1 billion people, many in mega cities, including the United States, that would be significantly impacted by a rise in sea level. Now, many countries like the United States may have the economic capacity to invest in factors that keep flooding from happening, or at least delay it. But there are a lot of places in the world that simply don't have those resources. So rising sea level is going to be a major impact on human health and well-being in the next few decades. We're also seeing increased drought. We talk a lot about it in the United States, especially in the Southwest, and you can see those darkest areas are extreme drought and exceptional drought. But we also see it globally. That's where droughts have been in the last previous decade, one previous to this one, but this is where they're expected to be. And you can see this tremendous increase in global drought. Drought, of course, impacts agriculture. It impacts the ability of people to move. It impacts human life. It is a major problem. Wildfires is something we're very well aware of in Tennessee and in many other states in the United States. The United Nations now estimates that the risk worldwide of devastating fires can increase by 50% by the end of the century, primarily because of climate change. And this is a significant problem because it causes us to lose forests, which play an important role in keeping oxygen and carbon dioxide balanced in the air. But unfortunately, it also produces pollution from the smoke. And of course, without belaboring it, it also directly impacts people who live near or in those forested areas. I don't have time to cover all the rest except to jump ahead to human habitat. You think about all these factors we've talked about: rising sea level, increased drought, wildfires. It's going to significantly impact people. And the World Bank has estimated that the impact of climate change altogether, water scarcity, loss of agricultural land, sea level, may force 140 million people to become migrants, that they have to move from their current home. Unfortunately, many will move to urban areas, which exacerbates all of the problems that we have with massive urbanization, unemployment, the spread of disease, access to healthy food. And ironically, because urban areas are hotter, they will have increased heat stress. So what should I know about the global heat wave? It's a bad analogy, but it's the tip of the iceberg. It's the beginning of what we're going to keep seeing. And it's going to have a significant impact. As I said earlier, the UN says it may be the greatest threat to human health. Whether it is or not, it is going to be a significant impact, and one that we have to think about, we have to address in a non-political and productive way. If you'd like to be added, if you know anyone who'd like to be added to our mailing list, please let me know. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. If you have any questions about what I've said today about global climate change, or what we've talked about in the preceding weeks about guns, multivitamins, monkeypox, or of course, COVID-19, please let me know. I look forward to hearing from you. Until next week, please be well.